discussing the principles of drug action. We will be focusing on the drug administration phase, the pharmacokinetics phase, and the pharmacodynamic phase, and a brief description of pharmacogenetics. To begin, we look at the administration phase. This phase is how the drug is made available to the body. Next, we will look at pharmacokinetics, which will be important when you do your research project 1 and 2, and basically means what the body does to the drug. And lastly, pharmacodynamics, which is what the drug does to the body. Let's discuss the administration phase first. This encompasses both the drug dosage form, which is the physical state of the drug, and also how it is administered. As we can see, drugs can be administered via tablet, capsule, suppository, elixir, or suspension, which is solution. We also need to consider the inactive carriers in each drug, for instance, propellants in our metered dose inhalers. How the drug is administered is another huge consideration. Enteral routes are routes from mouth through the digestive system. They include oral, sublingual, under the tongue, nasogastric, gastric, and jejunal tube administration that we often see in the hospital setting, and rectal administration. Parenteral routes are anything with a needle or injectable, for instance, intravenous, injected into the vein or IV, intramuscular, injected into the muscle or IM, subcutaneous, injected under the skin or SC, intrathecal, into the spinal cord, IC, or intraosseous, injected into the marrow of the bone, or IO. Transdermal routes include patches like our nicotine patches and pastes or creams such as cortisone cream. Inhalation routes, the ones we use as respiratory therapists almost exclusively, are aerosol and gas delivery. Aerosol producing a local effect in the lungs, and gas delivery a systemic effect, such as anesthesia. Topical administration are our powders, lotions, and ointments that are applied to the skin. The difference between transdermal and topical delivery is that transdermal medications produce a systemic effect, where topical administration produces a local effect. Now, let's look at the pharmacokinetic phase. This is how the drug moves through the body from absorption through elimination. The first phase, absorption, is dependent on whether the drug is water-soluble, aqueous diffusion, fat-soluble, lipid diffusion, or can be actively transported via special carrier molecules such as amino acids or peptides, carrier-mediated transport. The goal of absorption is to make the active ingredient in the drug available to the body. The term bioavailability indicates the proportion of a drug that reaches the systemic circulation or bloodstream. For enteral drugs, those given orally, etc., there is less bioavailability due to first-pass effect, which we will discuss in a minute. For parenteral drugs, bioavailability is greater due to either direct introduction of the medication into the bloodstream, IV, or areas of rapid diffusion to the circulatory system, such as intraosseous, IO. Next, we have the distribution phase, which means the process of transporting the drug to an action site, for instance, a heart muscle, or to elimination site, for example, the kidneys, or storing it within the body. The term volume of distribution means the amount of drug given divided by the plasma concentration of the drug, and is useful to see how the drug is absorbed and distributed. The next step in pharmacokinetics is metabolism, and the organ for metabolizing medications is the liver. The major enzyme system within the liver is cytochrome P450, or CYP, which is further broken down into CYP1 through CYP4. This is where we further discuss first-pass effect. For medications that are given orally or through the digestive tract, they must first go through the portal vein, which drains this blood into the liver, and this drainage is shown in the next slide. The blood from the liver then drains from the right and left hepatic veins into the inferior vena cava and then into the circulation. If a drug is highly metabolized by the liver in this scenario, then most of the drug's activity is terminated before it ever reaches the circulation. This is first-pass effect. Therefore, to overcome drugs that are more susceptible to first-pass effect, like fluticasone or Flovent, another delivery system other than enteral is necessary. Of course, we administer it via aerosol or MDI. Parenteral routes, sublingual, transdermal, rectal, and inhalation avoid first-pass effect. The last phase of pharmacokinetics is elimination. The primary site of elimination is the kidney, but hair, skin, and even exhaling can be routes for drugs to be eliminated. Plasma half-lives are used to measure how quickly a drug is eliminated and indicates when the concentration of the drug in the plasma decreases by 1/2. This brings us to the pharmacokinetics of inhaled aerosol drugs. Of importance is what's called an LT ratio. It is defined as the total availability of a drug to the lungs versus the availability of the drug to the systemic system. The higher the LT ratio, the more efficient the drug is at targeting the lungs and less side effects the patient will experience. Factors that affect the LT ratio are efficient delivery devices, mouthwashing, rinsing and spitting after aerosol delivery, and the use of reservoir devices such as spacers and holding chambers. The term pharmacodynamics is what the drug does to the body. The term of importance here is therapeutic index, which is defined as the ratio of lethal dose for 50% of the test population to the effective dose, provides a desired clinical response for 50% of the population, and is shown in the therapeutic index curves in slide number 23. The terms for drug interactions and drug responsiveness should also be reviewed. Lastly, the term pharmacogenetics refers to hereditary differences in the way the body handles specific drugs. Common medications we use in respiratory and critical care that exhibit changes due to heredity are isoniazid, or INH, that we use for TB, and succinylcholine that we use in rapid sequence intubation.